Have you ever been at the therapist's office and you're filling out your little checklist sheet and it says inability to experience joy at things that would normally be pleasurable? What we're screening for in the clinic is something called anhedonia. And anhedonia is just that. It's the inability to experience joy at things that would normally be joyful. And anhedonia is isolated in that it is simply about joy, not about emotion, not about emotional numbness, just the inability to experience joy from certain things. And anhedonia can also be very selective. You can have social anhedonia. You can have pastime anhedonia. There's various little chunks. Like, it can be very specific. Like, you can experience joy from some things and not from other things, but it's usually in relation to things that would normally be pleasurable or enjoyable. And this can even include sexual intimacy. Anhedonia is usually related or like comes in tandem with things like bipolar, major depressive disorder, and post-traumatic stress disorder. However, it can be its own standalone thing. Beautiful thing about anhedonia is that it's actually very treatable. We can utilize cognitive behavioral. I like to make words good. Cognitive behavioral therapy, dialectic behavioral therapy, EMDR, accelerated resolution therapy, somatic experiencing, integrated trauma processing, brain spotting. We can utilize all of these things to treat anhedonia, depending on what the root source of the anhedonia is, because some doctors actually believe that it is related to the actual brain function, the structure of the brain. Some people are just wired to not be able to experience joy. But as one of my favorite clinicians that I learned from many years ago once said, neurons that are firing are always rewiring, which means that as we're developing, especially if we're experiencing anhedonia in our younger years, it is much easier to address because a young brain is like silly putty. It's very plastic, stretchy, bendy, constantly adapting. We're not the whole person that we are until we're the whole person that we are. And, that is actually one of the areas where ADHD has a bonus, because the ADHD brain, unlike the neurotypical brain that is fully developed between 25 and 27, the ADHD brain is not fully developed until it's 34. So we've got a little bit of extra time to unfuck some shit when we're from our jacked up childhood. Yeah, so cool stuff. And that's something new, and knowing stuff is cool, and so are you. Also, just like a really sick side note, I feel like anhedonia would be like a really cool roller derby name. Can you see it now? Can you see it?
And now, coming to the ring, number 16, Anhedonia. She takes no pleasure in what she's about to do to her opponents.
It writes itself. I should probably wait for my meds to kick in before I make another video.